The last thing we're going to take a look at here is what occurs to the systems in terms of regulation based off of aging. And a lot of what we're going to look at here may not line up with what we normally think about as we think about changes with aging and how it usually gets talked about within popular press. Regardless of whether we're looking at males or females, there's a dysregulation that's going to occur with increasing age. For the males, we see at about age 60, a truncated or a dysregulated response globally to nearly all androgen signals and most anabolic hormonal signals. This tends to reappear a couple of years later, which means that we no longer get that truncated response. We no longer get that dysregulated response. And then we get a continual exponential decay over the next 2 decades of life. For the males, this leads to a change in the pulsatile release of testosterone based off of changes in the concentrations of GnRH and changes of LH. That's going to occur throughout the lifespan that gets modified a little bit based off of ultradian spikes that occurs similar to what we saw in utero and in puberty. As we continue through life, we seem to get a reduction as relates to testosterone levels, and this correlates with changes that we see in the necessity for reproductive functions as well as the necessity for tissue repair, which means that if we can stimulate tissue repair or cause a need for tissue repair, we're going to see continual ultradian spikes of testosterone throughout the individual life. The change that we see in GnRH and the change that we see in LH is going to lead to that dysregulation of gonadal functions. And so what does this look like? So as we continue through reproductive age, what we see is a exponential decay in both the amount of testosterone total, as well as the indexed amount of free testosterone that we are able to measure. Now notice we will start seeing a plateauing of effect in that time frame of the androgen pause that will start to come back as we continue out, and then we see a plateauing effect as we head through age. There seems to be a slight uptick very late in life in terms of the amount of free testosterone indicated within the index here, and that may be due to the changes in the binding globulins more than in the production of testosterone. And we can see that if we look at how much we see in terms of the amounts of testosterone that we have going into circulation, both in terms of total testosterone as well as free testosterone. Notice that we have changes in the sex hormone binding globulins throughout reproductive age, and the changes that we see in both the free testosterone as well as in the sex hormone binding globulins is an indication of the need for testosterone based off of reproductive functions more than anything else. For the females, there's slightly different change that takes place here. There is a dysregulation in the response to FSH, and this leads to a truncated global response to all of the estrogens more than the androgens, as well as a reduction in anabolic hormone responses. Now, within the females, we don't see a rebound. We don't see a return to levels that we had at the initiation of loss. And this has to do with the change in responsiveness of the ovaries to FSH. So what we end up seeing is ovaries stopping the response to FSH. This stop in response to FSH leads to hypothalamic dysregulation, particularly in the GnRH neurons and in the estrogen sensitive cells, leading to a hypersensitivity to estrogen due to the reduced levels of estrogen in the plasma. Now, these same neurons that are going to be sensitive to estrogen and sensitive to GnRH are also going to be sensitive to changes of body temperature and the regulation of body temperature that can be associated with the senses of hot flashes that occur during the menopausal timeframe. This dysregulation of FSH sensitivity leads to ever increasing levels of FSH and changes in pulsatility of LH due to the loss of the cyclic circadian rhythms. that is associated with the positive feedback of estrogen at the initiation of LH secretions. And this leads to the dysregulation of the gonads and the loss of menses. Now, it needs to be stated here that a lot of late life health issues that are associated with female physiology tends to be linked with a loss of estrogen due to estrogen's ability to hood or block a lot of ROS accumulations that occur due to metabolic functions. And because that loss of estrogen occurs, they lose the ability to have the antioxidant stimulations that lead to the limiting of ROS actions. And this is one of the reasons why we see an increased likelihood of ROS and or metabolic issues for females later in life. So let's take a look at these changes that we see in terms of estrogen in particular. Now notice we have our various stages of puberty, our Tanner stages of puberty. Notice that we see an increasing levels of estrogen, both in terms of total E, as well as our reference values for the inactive and active forms of estrogen. That change that we see within the circulating levels of estrogen is the indication of ovarian actions. And as we see changes in ovary actions leading to ovulate formation and ovulate release, particularly as we head through the later Tanner stages and into reproductive ages. Now notice what happens as we get towards premenopausal areas. We're still at that stage 5 level of pubertal development, which is going to be the same level that we see throughout most reproductive lifespan. However, once we hit that postmenopausal area, we're basically back to where we were at stage 1, stage 2 levels of estrogen and estradiol for the female. And why is that occurring? Well, that's occurring because we end up having a change in the responsiveness to FSH. And so one of the things that we can indicate a change towards menopausal timeframe for the female is a ever increasing level of FSH, notice the squared lines here, and the ever decreasing levels of estrogen, notice the triangle lines here. But notice for both FSH and LH, it's never at 0, which means that we don't actually get no estrogen and we don't ever get no FSH. There's always some level of estrogen and some level of FSH. However, as we see in the previous slide here, the levels are so low that we cannot support the normal cyclic circadian rhythms necessary to induce ovulate formation and ovulation of the oocyte of the egg cell. And so that takes us through the aging process that occurs for both the male and the female reproductive physiology based off of hormone regulation.